Well, I watched this film earlier today, and one of the things that struck me was the toxic stress that we're adding on to these children as we put them into these environments. All of these children, when I watch them, I would guess that the majority of them come from some kind of a trauma background, and they do not know how to emotionally regulate. So by locking them into these systems or using things such as isolation to help them emotionally regulate actually make things a lot worse. It adds a lot more toxic stress to their lives, and it is in no way therapeutic for helping them learn a new skill set. If they had skill sets to fall back on, they wouldn't be able to begin with. So you can't just lock somebody up and say, do what you know, because they do what they know, which is not emotional regulation.
The first time that I watched this particular movie, it was probably 3 or 4 weeks ago when we first started talking about the panel. And really what it did for me is it just reinforced changes that the department began just under 8 years ago. Secretary Wansley Walters was appointed to take charge of our department, and she brought with her, or put together very quickly, the roadmap to systems excellence. And there was a number of different initiatives in this, but the primary focus of the plan through all levels of the department was to find the right services for the kid at the right time and the right frequency instead of trying to cookie cut everything. Additionally, it was focused on intervening as early as possible and trying to keep as many kids in the community in the least restricted environment, rather than going to the residential programs, which, as indicated earlier, have a recidivism rate of around 48%, and that comes directly from our data and research department. But to kind of put the exclamation point at the end of that sentence, 8 years ago we had nearly 7,000 residential commitment beds. And a residential commitment, I guess you could compare that to a juvenile prison. That's where they go for a long-term program. We had nearly 7,000 of those beds. Now we have just under 2,500 because we really have put an effort on assessing the needs of the child. We want, absolutely want to keep safety of the public in mind, but we also want to look at are they really a danger if they're out in the community. If they're not, then that's where we want to keep them. We want to hook them up with the services that they need in the community. If they are assessed and are high risk and wind up in a program, then we also want to make sure that the programs that we're providing are giving the services that they need. So that was where that focus was. One of the other things that they've done, you looked at the different settings that they had for those programs, and you realize how stark and how hard that is. I mean, you get a concrete room that's usually a bland color with stainless steel toilet and with a concrete bed that they call a bed, and they put a mattress about yay thick on it, and they say, here you go. And then you heard them talk about putting kids in confinement and for long periods of time. And even I, when I started my career, I started, as I indicated, with 2 different sheriff's offices working in the jail. And I was on the other end of seeing those things happen. But to understand that you get stuck in those rooms with the door shut with nothing to do, that would push me over the edge too. But that was one of the other things that we did, is we really cut down on the size of the programs. We had a number of programs that were up over 300 beds. And when you put 300 kids, all high risk to reoffend, together, you're going to have problems. Now I think the biggest program we've got is about 50. And that allows those programs to really focus on interacting with the kids, identifying what those needs are, and addressing those needs. Additionally, many of the programs don't even have locking doors anymore. They can go to their room, but the room doesn't, it's just like at home. They can come and go out of their room. And they've also taken steps to kind of soften, use different colors, allow some personal things. I don't know how many of you were at the trauma event that Lakeview held a few weeks back, but our Assistant Secretary for Residential Services was in there, and she talked about challenging the norms. They used to have kids sound off as they counted through an area. They walked with their hands behind their back. Well, the question became, why would you do that if you were outside, and what purpose does it serve in those programs? What purpose does it serve when they're getting ready to go back? And then we've also put a renewed focus starting 8 years ago, the transition back into the community. Are we connecting them with the services that they need? Are we connecting them with the people they need? Are we connecting them back to the schools and really emphasizing that process so that we can have kids that succeed once they get out of those residential commitment programs? Our kids are involved with us from day one. As soon as they're arrested, they're going to be processed. Even if they're not arrested, the law enforcement officer has two options. They can arrest and put them in handcuffs and haul them off, or they can file a warrant. And I'm not considering civil citation in that, but those are generally the two ways that a kid's going to wind up in our JAC in the system. We're going to do an assessment when they walk through the door that identifies what their different needs may be. It's going to look at their social interactions, the school, their family, the mental health, substance abuse, peers, a number of different areas to see where are their strengths and where are their weaknesses and what we can do to shore up those weaknesses so that we can connect them with the different service needs. A lot of the services that Dr. Lord talked about, we access with many of our kids. And we have some other different contract providers that we can access to get some of the services in place. But that starts day one. We're looking at those things, and then we're looking at, can we divert this kid out of the judicial portion of the system? These are for kids that didn't get a civil citation. We're going to look at those kids first to see if we can divert them into something that's non-judicial. And then if we can, then we're going to look and see, as I said, through these assessments, what their needs are and if they're best handled keeping them based in the community. And my probation officers will be involved with them the entire time, whether they're in some kind of a diversion program, whether they're on probation, even when they go off to commitment program, we're going to have a probation officer that's involved with them. That's kind of the one steady piece through this whole process, that once they get out of the commitment program, they're still involved, generally with that same probation officer, to provide some stability for those kids. But that's just a little bit. When we get through the question and answer piece, I'll talk a little bit more about civil citation and some of the diversion options that we've got.
Thank you, Paul. My name is Rodney Jones. I've been working with juvenile and adult offenders for about 15 years. I have a background in social work, clinical mental health, currently in my dissertation stage for my social psychology degree. And been doing this quite a while. I totally agree with the film because the system, the juvenile system, is difficult to navigate. Once a youth gets trapped in this juvenile system, now non-law violations come into effect. See, once they're in, that's why our system sometimes backs up to the degree that it has backed up to. Because when you've committed a law offense and you've incarcerated this juvenile, he could be doing well, very well, no more law violations or anything of that nature. However, if he violates any school rules, if he misses days of school without absences, or, if you're a middle schooler, you got 7 periods a day. If you, God forbid, are late for a couple of them, maybe just a couple times a week. But over the course of a month, all of those will be counted against him. So this kind of, bottlenecks our system. Although I agree with Paul, there are some subtle changes being made. But I have to ask myself sometime, are they so subtle, will they even be relevant? Because that's what we want to do. We want to make it relevant. If we put something in place, it has to become relevant for the youth that we put it in place for. If not, why are we doing it?